Imagine this. You're a 62-year-old woman. You've raised your kids, worked your whole life, made it through menopause, and now finally, you have time to live for yourself. One morning, you wake up feeling a little more tired than usual. Maybe your back aches, maybe your stomach feels a little off, or maybe you're just wiped out for no reason. But you brush it off. Probably just something I ate, you think. Or, I guess that's just getting older. But what if it's not indigestion? What if it's not just fatigue? What if it's your heart quietly, gently trying to warn you that something serious is about to happen? Here's the scary truth. Heart attacks in women often don't look the way we expect. There's no sudden crushing chest pain, no dramatic collapse, just a sense that something's off. Overwhelming fatigue, unusual anxiety, a dull ache in your jaw or back, and by the time you decide to see a doctor, it could be too late. Too many people still think of heart disease as a man's problem. But the reality, heart disease is the #1 killer of women in the US. Even worse women are more likely to die after a heart attack, not because we're weaker, but because our symptoms are different and too often ignored. In this video, we're uncovering 7 silent signs of heart attack in women. Subtle warnings that could save your life or someone you love. If you're a woman over 50 or you care about one, please don't look away, because what you're about to hear could change everything. Have you ever thought, I eat pretty healthy? I don't smoke, my blood pressure's fine. I'm probably not at risk for a heart attack. That mindset is surprisingly common among women, but it's also exactly what makes heart attacks so dangerous, because they catch you off guard. Here's the truth. After menopause, a woman's risk of heart attack spikes, sometimes even matching or surpassing that of men the same age. Before menopause, estrogen acts like a natural shield. It keeps blood vessels flexible, regulates cholesterol, and helps your heartbeat stay steady. But once estrogen starts to drop, that protection fades, and your heart becomes more vulnerable quietly, day by day. A major U.S. study that followed over 5,000 women for 21 years found that women who go through early menopause before age 45 have a 33% higher risk of heart failure compared to those who hit menopause at a normal age. So, if you're in your 50s, 60s, or beyond, especially if you've been postmenopausal for a few years, this could be the most critical period for your heart. The problem: most women don't realize it. There are no obvious symptoms, no chest pain, no dramatic shortness of breath, just a slower pace, less energy, and that vague sense that you're aging faster than you should. And because it doesn't feel urgent, they don't get checked. Until one day, the heart speaks in a way that can't be reversed. If you're over 50, especially in your 60s or 70s, it's time to understand this. Estrogen is no longer guarding your heart, and now is the moment to take your health into your own hands. The good news: you can spot the warning signs if you know what to look for, and one of the most overlooked symptoms might be hiding in plain sight. Have you ever felt completely drained and had no idea why? You just woke up, but it's like all your energy is already gone. Grocery shopping feels exhausting. Doing laundry wears you out. Even standing up from a chair takes effort. But you don't have a fever, no headache, nothing obviously wrong. And you think to yourself, maybe I'm just getting older. Be careful. It might not be age. It could be your heart crying out for help in a way many people never expect. The heart is a non-stop blood-pumping machine. When it weakens, it can't deliver enough oxygen and nutrients to the body fast enough or evenly enough. That means your muscles and brain, the very parts of you that keep you going, aren't getting what they need. And the first sign you might notice isn't chest pain. It's a strange kind of exhaustion, Like someone flipped a switch and drained every bit of energy from your body, even though you haven't done a thing. A study from the American Heart Association found that nearly 70% of women who suffered a heart attack said they felt unusual fatigue in the days leading up to it. What's terrifying is most of them never suspected it was heart-related. I once heard the story of Ruth, a 64-year-old woman from Michigan. She was healthy, never hospitalized, always active. One morning, she felt a little tired, went grocery shopping, and suddenly her legs started shaking. Her back broke into a cold sweat. She had to call someone to drive her home. 2 hours later, she was in the ER. The doctors told her she'd just had a minor heart attack, and if she'd waited a few more hours, the outcome could have been fatal. If you ever feel that kind of exhaustion, the kind that makes no sense, don't ignore it. Don't blame it on aging or the weather. That could be the first and only warning sign from your heart. And that's just one of the many signals that often get mistaken. There's another one just as common, but most people chalk it up to a stomach issue. Let me walk you through a real-life scenario. A 59-year-old woman, no smoking history, no diabetes, still takes a light walk. Every morning walks into the ER in Dallas at 8:00 a.m. She's been feeling bloated, slightly nauseous since the night before. She figures maybe the salmon she ate wasn't fresh. No fever, no chest pain. Her pulse and blood pressure totally normal. At first, the doctors think it's just gastritis. But 2 hours later, her EKG shows clear changes signs of an inferior wall heart attack. By 10:30 a.m., she's in the cath lab. Her main coronary artery, 98% blocked. No chest pain, no shortness of breath, just nausea, bloating. One sleepless night. So why does the heart sometimes pretend to be a stomach issue? It comes down to the nervous system. The heart, stomach, and diaphragm are all connected by a complex web of sympathetic and parasympathetic nerves. When your heart is starved of oxygen, the pain signal doesn't always show up in your chest. Instead, it can radiate to the upper stomach, causing nausea, bloating, or a dull ache around your solar plexus. This is known as referred pain, when pain shows up in a different area than the source. Here's what makes it even trickier. Women often experience pain differently than men, thanks to differences in how our nerve receptors respond, both on the surface and in our organs. That's why so many women's heart attacks are misdiagnosed as ulcers, indigestion, or even irritable bowel syndrome. If you've ever felt nausea, bloating, or a sudden loss of appetite but no fever, no diarrhea, and no clear reason, stop for a second. Don't rush for the antacids. Don't blame the food. Ask yourself, is my heart trying to send a silent signal? Because not all heart attacks start in the chest. Some of them start in the last place you'd expect your stomach. And if that sounds surprising, the next symptom is even easier to overlook. A dull backache that feels like bad posture. But in reality, it could be your heart struggling in silence. Have you ever felt a dull ache in your neck and shoulders? An upper back soreness, or a strange tightness in your left shoulder, and just chalked it up to bad posture, sitting too long, or the weather turning cold? Most of us believe that if it's a heart attack, there has to be sharp chest pain. Like you see in men, but in women, the heart cries out in a very different way. It doesn't scream. It spreads quietly. When part of the heart muscle is starved of oxygen, the pain isn't always centered in the chest. Thanks to referred pain, your brain can interpret that distress through nerves connected to the chest, neck, jaw, left shoulder, or upper back. For women, this pain often feels different. It's not crushing. It's described more like tight aching or tense, which is why so many women dismiss it as something minor. Take the case of a 58-year-old office worker from Ohio. She felt a dull ache radiating from her upper back to her left shoulder. She was tired, a little off, but not in pain exactly. She used heating pads, muscle rubs, even took ibuprofen, but nothing helped. Then she collapsed in a meeting. Doctors later confirmed she'd had a STEMI, a major heart attack with ST elevation. Her heart had already suffered permanent damage because she waited nearly 6 hours before getting help. All it would have taken was a simple EKG, and that damage could have been prevented. See, neck and back pain isn't always just a muscle or just your joints, and especially if it comes with any of these signs: fatigue, unexplained anxiety, nausea, shortness of breath while walking. Don't play the guessing game. A woman's heart doesn't always follow the textbook symptoms. It might give just one warning sign in a place you'd never expect. And if you ignore it, the cost might not be a few ineffective painkillers. It could be spending the rest of your life living with a heart that's been damaged for good. In the next part, we'll talk about a symptom that even doctors often overlook: cold sweats with no clear reason, especially at night or while resting. You're sitting still, not moving. The room temperature is perfectly normal. Then suddenly, you break out in a cold sweat. It's clammy, sticky, makes you shiver. No fever, no racing heart. Just a weird passing wave of sweat. And then it's gone. You shrug it off. Maybe it's hormones. Or maybe I'm coming down with something. Don't ignore it. In cardiology, unexplained cold sweats are a major red flag, one of the early warning signs of a heart attack, especially in women. Why does it happen? Because your heart is struggling, fighting to pump blood through a blocked artery. When blood flow to the heart drops, your sympathetic nervous system kicks in and floods your body with adrenaline in an attempt to keep your blood pressure and heart rate stable. One of the side effects: cold sweats even when your body isn't hot. It's a survival response. Your body is sounding the alarm, not with chest pain, but with sweat that doesn't make sense. The sad part: most women don't connect it to their heart. They blame hormones, menopause, stress, anything but their cardiovascular health. A study by the American Heart Association found that nearly 40% of women hospitalized for a heart attack had experienced abnormal sweating in the 24 to 48 hours beforehand, but none of them thought it was heart-related. And you know what's even more dangerous than cold sweats? When they happen at night while you're asleep. You wake up in the middle of the night soaked. Your heart's pounding, no cough, no fever, no pain. And you try to fall back asleep because you've got work in the morning. But what if that was a silent heart attack in your sleep? A warning sign you didn't even know to look for. Here's the bottom line. If you break out in a sweat for no reason, especially if it comes with anxiety, fatigue, dizziness, or a dull ache in your back, don't wait. Go to the hospital. It's better to be wrong than to be too late. And if cold sweats sound confusing, wait until you hear what's next. Why even doctors can miss heart attacks in women, and how the medical system has quietly overlooked half the population. Here's a hard truth that rarely gets said out loud. Many women don't die because their heart attack was too severe. They die because it was misdiagnosed. This actually happened in Chicago in 2015. A 52-year-old woman walked into a clinic feeling tired, anxious, and with a heavy sensation in her chest. Not sharp pain, not obvious shortness of breath. The doctor asked a few questions, checked her pulse, and diagnosed her with anxiety. He gave her a mild sedative and sent her home. 2 hours later, she collapsed in a parking lot. She died on the way to the hospital. The autopsy confirmed a massive inferior wall heart attack. The heartbreaking part: even doctors sometimes don't consider a heart attack in women unless they follow the classic script: crushing chest pain. Down the left arm, sweating, collapse. But here's the thing. This pattern was called out way back in 1991 by renowned physician Dr. Bernadine Healy. She coined the term Yentl syndrome, referring to the idea that women are only properly diagnosed if they present symptoms the same way men do. Why does this happen? Because for most of the 20th century, nearly all medical research was done on men. Symptoms, treatment plans, textbook images, all based on the male heart as the default. So when women show up with different, less obvious symptoms, they're told it's psychological, that they're overreacting, that it's just stress. Even today, according to Harvard School of Public Health, 38% of women hospitalized for a heart attack are misdiagnosed during their first evaluation. For men, that number is just 17%. This isn't just a medical issue. It's a cultural blind spot where the quiet signals of a woman's heart are too often dismissed as weakness, exaggeration, or not serious enough. You may not be able to change the system, but you can change how you respond by knowing what to look for and what action to take when your body speaks up. And that's why the next part is the most important of all. It'll give you a 5-point checklist. Simple, concrete steps you can take right now to make sure you're never just another number in a tragic statistic. None of us wants to become just another number in the heart disease death toll. But to truly avoid that fate, we can't wait for our hearts to cry out in agony. We can't wait for unbearable chest pain to force us to act. There are 5 simple steps, small but powerful, that could draw the line between life and loss for any woman over 50. First, get your heart checked regularly, even if you feel fine. One of the biggest reasons women have higher death rates after a heart attack is because they arrive at the hospital too late, not from neglect, but from underestimating their own symptoms. You don't need to wait for pain to show up. Get an EKG every 6 months, and if you have high blood pressure or a family history of heart disease, start even sooner. It only takes 10 minutes, but those 10 minutes could give you 10 more years. Second, pay attention to anything in your body that feels off. Many women who've survived heart attacks say they sensed something wasn't right. Not pain, just an unfamiliar feeling they couldn't quite name. Trust your instincts. Write down changes in your sleep energy, digestion mood, or anxiety. Listen closely. Your body is speaking if you're willing to hear it. Third, keep an eye on the quiet risk factors. A heart attack doesn't come from a single stressful day. It builds silently through rising blood pressure, creeping cholesterol, high blood sugar, and inactivity. Check your numbers at least once a year. And if they're starting to trend upward, that's your chance. Don't wait until medication becomes your only path forward. Make changes while you still have options. Fourth, make movement a daily priority, but one that matches what your heart can handle. You don't need to push hard or train like an athlete. Just 30 minutes a day of light activity. A brisk walk, stationary cycling, breathing exercises, or heart-friendly yoga can do wonders. If you find yourself winded walking upstairs or feeling drained after a trip to the store, that's not just aging. That's your heart waving a red flag. And finally, share this with another woman. If what you've learned today opened your eyes, then you carry a responsibility. Pass it on to your sister, your mother, your best friend, your co-worker. Because heart disease in women isn't just a personal issue, it's a public one. Sometimes a quiet, "Hey, have you had your heart checked lately?" can be the sentence that saves a life. You don't have to start big. You just have to start. With one decision, I won't wait for my heart to cry out in desperation. You've just been on a journey, not just one of medical knowledge, but a journey to better understand your own body and to reflect on how we've been treating the heart that keeps us alive. Take a moment to recall the 7 silent warnings the quiet whispers from the heart that so many women overlook, that moment after menopause when the shield of estrogen disappears. That strange, unexplained fatigue, even when you've done nothing strenuous. That wave of nausea or bloating you thought was just something you ate. The dull ache in your neck, jaw, back, or left shoulder when the real trouble was in your heart. The cold sweat that appeared out of nowhere, even though you weren't moving. The misdiagnosis, even in a clinic with a doctor in the room. And finally, the most overlooked danger of all, not being prepared simply because no one ever taught us how to listen to a woman's heart. If any part of that feels familiar, even for a moment, don't brush it aside. If you've ever delayed a heart checkup because you thought I'm probably fine, don't wait again. And if you've ever lost a woman suddenly and only later learned it was a heart attack, then you already understand why this video had to be made. This isn't just information. It's a wake-up call, a second chance. I'm not asking you to share this to boost views. I'm asking you to share it so that one more woman doesn't stay silent until it's too late. If that woman is you or someone you love, let this video be the reason you finally schedule that heart checkup. Because a woman's heart may go quiet when it's in pain, but the consequences of that silence will never be quiet.